Hi, I'm Sharyn Lewin. I'm the Director of Gynecologic Oncology at Holy Name Medical Center in Teaneck, New Jersey. I'm also an Assistant Clinical Professor in the Department of Obstetrics and Gynecology at the Icahn School of Medicine in Mount Sinai, New York, New York. Welcome. Thank you for joining all of us today. This is an important time to talk about cancer care in the time of COVID-19. So I want to talk a little bit about how are you managing patients with gynecologic cancer or with gynecologic issues during COVID-19. So there are several different things to think about. Number one, the role of surgery. Number two, the role of chemotherapy and or radiation. And of course, number three, how long is it safe to wait? So as you may have heard from some of the national media, our particular area was and is very hard hit with COVID-19. The incidence as well as the prevalence of the disease came very early, very suddenly, and we really have been at our institution an epicenter for the disease within the state. So this made us really think about the role of surgery and the role of treatment for our patients early on. The last time that I did surgery was March 16th. As you may or may not be aware, the American College of Surgeons, as well as the Surgeon General, did put out guidelines suspending elective surgeries in the United States. And that gave us time to think about how do we best prepare our patients as well as our providers and institutions for the care of women needing surgery. And of course, men as well too, but as a GYN oncologist, I'm particularly focused on my women with cancer and those with gynecologic benign issues. So certainly emergency surgeries are going forward. Emergency surgeries are ones that need no delay. If a patient's life is imminently in danger without having the surgery. So in the realm of gynecologic care or gynecologic oncology, that may be things like an ectopic pregnancy, for example, very acute or severe vaginal bleeding, cesarean section, bowel perforation, things that if a patient does not have the surgery could imminently result in death. So of course those surgeries are going forward. The tricky part for us though is that cancer or suspected cancer of course is potentially life-threatening and surgeries may cause delay or may cause harm rather if they are delayed. And that's where it gets to be an important discussion between providers and patients, as well as a lot of shared decision-making with patients. So what has happened over the past 2 weeks? A lot of our colleagues have gotten together, for example, in the Society of GYN Oncology and had webinars almost on a weekly basis all across the country to talk about how we are preparing to take care of our patients, how the institutions are preparing, and you definitely see a lot of regional differences depending on which areas have been affected by COVID-19, as well as institutional resources, whether it's a community-based hospital or academic center, tertiary care, etc. So as you know, New York and New Jersey have been really epicenters, particularly our town, for COVID-19. We've been preparing for this for some time. We, in our division, really have been examining patients on a case-by-case basis to see who really needs surgery and to see if there are other modalities that we can employ to temporize them until surgery is safe. You have to not only think about the safety of the patient, bringing someone into a hospital where there is an abundance of COVID-19, but of course you have to think of the role of the providers as well as the entire medical staff and how many touches it takes to get a patient into the operating room, for example. A person may meet with healthcare providers, 8 or 10 of them, if not more, from entry until surgery and thereafter. So you always have to think about the risks and benefits. For example, our women with grade 1 endometrial cancers, there is good data that Mirena IUD, for example, or oral progestins can temporize, even treat their endometrial cancer, and then we can postpone surgery at least 3 months, if not longer. So we're certainly employing other options rather than surgery for these patients. For example, in women with advanced ovarian cancer, we've moved towards biopsy and neoadjuvant chemotherapy, giving chemotherapy first rather than surgery. So in our field, there are definitely options to postpone surgery. If we can use hormonal measures, we are. If we're using chemotherapy or radiation, we are. And in some cases, there are definitely literature that supports the safety of waiting. For example, there is data in women with high-grade endometrial cancer that postponing surgery even 8 weeks does not adversely affect outcomes. So it is really important to talk to your colleagues, to have these weekly webinars among your societies to talk about which patients can be safely postponed with surgery, which patients need to go forward with chemotherapy and radiation now, and really how safe it is to wait. We are also reevaluating all of our chemotherapy patients pretty much on a daily and weekly basis, because as you do see with COVID-19, that things rapidly change on a daily basis. We've seen that just how much things have changed in the past 2 weeks from one day to the next. Patients that are under curative intent chemotherapy, we are proceeding with treatment for all other patients. We do talk to them about the risks and benefits of coming into the infusion center, of leaving their homes, potential risks if they do have any myelosuppression. So it really is shared decision-making between the providers and the patients. I have to say, by and large, pretty much all of our patients are going forward with treatment. They want to do that, understanding the risks potentially of myelosuppression, as well as coming out of their homes. The only patients potentially who have not gone forward with treatment, at least in the past few weeks, are those that are in their 80s or 90s, who have recurrent disease, not symptomatic, thankfully, and we're trying to keep them at home and avoid coming out to the hospital or even out into the community where they could potentially be exposed. So again, it does have a lot of shared decision-making with patients, but we do have societal guidelines and research that do help guide us in terms of how long is it safe to wait for particular surgery and chemotherapy. So what are the greatest concerns in standard care delivery outside of things like PPE? So really it is managing gynecologic cancers, staying connected with patients, and also the mental and physical well-being for patients and their families. So I think things like the weekly webinars, the chat rooms that I've talked about in our society, the Society of GYN Oncologists, have been very helpful to hear how practitioners are practicing throughout the country. We do have literature that helps guide us in terms of, is it safe to wait? But most importantly, really having these shared decision-making conversations with patients. So you do talk about the risks and benefits of treatment now, what the treatment options are, the safety in waiting, the risks in proceeding with therapy. So these really are very intense counseling sessions, but a lot of important shared decision-making between clinicians and patients. It is important that we really stay connected to patients, and we've been able to do that very nicely with telemedicine. I actually really enjoy speaking to my patients via telemedicine. I find that everyone is working at home. We have had a shelter-in-place order, so people are home, working from home. They're there with their families, and they really do enjoy staying connected to their clinicians. So really using Zoom or any of the other platforms, we actually have a Vital Health platform, which is an app that is downloaded. It's safe in the healthcare system, and it's been very nice to connect with patients and see them, even though we're not able to physically take care of them. We are still seeing patients in the office, but we've really tried to limit traffic flow just to see patients that are on treatment for chemotherapy and have really urgent needs that need to emergently be seen. Otherwise, everything else is being done through telemedicine. All surveillance visits, even new consultations, anything that can be done via telemedicine is being done that way. We also know that patients who are coming for chemotherapy, for example, are no longer allowed to come with any chaperones or healthcare providers. We've really tried to limit the flow of traffic in and out of the hospital. So we are trying to stay connected to their families, also via telemedicine and the telephone when they come for these visits. I think the mental and physical well-being for patients and families is of utmost importance at this time. So not only do patients with cancer have a lot of concern about their own health in light of COVID-19, but also if there are any delays in their cancer care, one way to help them still feel connected, my patients that are waiting for surgery actually have been performing telemedicine on a weekly basis just to check on them, make sure they feel connected, evaluate for any new symptoms. And we do try to stay connected to patients on a routine basis so they don't feel alone and they feel connected to their healthcare providers and the teams. We're also trying to impart some of our wellness strategy to patients, which I'll talk about in a little more detail in the next few slides. So since these challenges are not a one-size-fits-all, what are you personally doing differently? So as I mentioned, we have really moved to telemedicine, which is certainly a new platform. The last surgery that I performed was on March 16th. It's very odd for me as a surgeon, a cancer surgeon, a GYN oncologist to not be operating. We are and can do surgeries that are absolutely necessary, but I am reviewing those on a case-by-case basis, really assessing the risks to the patient as well as to the healthcare team as well. There are some institutions in New York City, for example, that are not operating on any patients unless the patient is imminently going to die without that particular surgery. That is not only to conserve resources, but also for the benefit of the patients as well, given the prevalence of COVID-19 in our hospitals. So we've, as I said, done a lot of telemedicine. It's actually been really nice to connect to patients and colleagues through telemedicine platforms. We are having national conference calls to really discuss best practices, which has actually been very reassuring and interesting. You do see that institutions are making recommendations based on the prevalence of COVID-19 in their communities, but certainly the ones where the prevalence is still low are preparing for what we're experiencing here in New York and New Jersey. As I mentioned, we're doing a lot of short interval follow-up calls and telemedicine for patients with active cancer so that patients feel connected to us and feel taken care of, even though we're not physically seeing them. I think it is very important to really limit the amount of visits that patients come into us. Our office is in a hospital setting, as is the infusion center, and we really are trying to limit foot traffic throughout the hospital in general. So any routine surveillance visits, those have been either rescheduled or done through telemedicine, and we're physically trying to see patients only that really need to be seen or those on therapy, and doing the rest via a telemedicine platform. It's also important that there are a lot of online or video conferencing availabilities for psychosocial support. For example, our GYN oncology support group is still meeting once a month. They're just using the telephone and Zoom as a way to provide support for each other. There are also a lot of national organizations like our own, the Lewin Fund to Fight Women's Cancers, that are providing peer-to-peer support and virtual support to help women with cancers through these very difficult times. We're also looking forward to providing some webinars about health and wellness, so please stay tuned for those as well. So there are some positive things to take away from this crisis. Certainly, we're finding that people are having much more quality family time. Nothing better than spending time with your family, and so we are finding that that is certainly one positive to take away from the crisis. There are definitely ways to stay connected with family and patients on a virtual basis. I certainly would recommend regular FaceTime calls or Zoom calls so that you can see your family and friends and patients if you're a provider, and certainly stay connected to them. It's also a really important time to focus on health and wellness. We had a wonderful webinar through the Society of GYN Oncologists just yesterday, which talked about, how to manage anxiety if you're a provider, because we do know that high levels of anxiety certainly impair performance. And a lot of these things, these strategies that were talked about, not only can we employ them as clinicians and healthcare providers, but our patients can also employ these as well too. So it's an important time to really focus on your basic needs, the importance of keeping your immune system healthy, really trying to exercise, whether that's in a virtual platform, doing things at home, taking a walk outside, getting fresh air, making sure you're getting adequate sleep, certainly healthy diet, a lot of literature about how a plant-based diet is so important to boost your immune system, eating lots of fruits and vegetables and lean meats, whole grains. So those things are really important not only for your mental health, but also your physical health as well too. It's important to stay connected, as I mentioned, through social support and virtual platforms. There are ways, to participate in community service as we've done, certainly donating items to hospitals in need, as well as donating food and different supplies. We've also worked on donating more funds for transportation services to help patients get to their appointments. Also more patient care funds to help with different funds and needs at home. So any of us can really get involved in community service to help not only our patients, but also our healthcare providers as well. One other thing that it's important too for clinicians to keep in mind is the importance of, limiting your anxiety if possible. Really try to live in the present moment. I do try to tell my patients this, in addition to some of my other colleagues as well. It's also important to really try to focus on one activity at a time and complete that activity. Things like meditation, for example, and yoga are very helpful to help manage stress. One application or app that I learned about yesterday that's interesting for clinicians is something called Headspace. If you download it, it's a free app for providers. You just put in your MPI, and it's a way to help sort of relax. It's targeted towards healthcare providers, so it's one important strategy for dealing with anxiety. And I also think it's important to really change the relationship with media. I mean, we're constantly bombarded with media now in the news, as well as working from home. And one suggestion that I heard yesterday that I thought was very helpful is to choose your reliable sources, maybe one or two, and just look at those one or two times a day, and spend the rest of the time focusing on work or family or other things that you need to do for yourself and your practice. It's also important to really think about a new normal. It's all been challenging for all of us to provide care through virtual platforms, for some surgeons to not operate, as well as to deal with working from home. Maybe you have young children, maybe you don't. It's important to really create a family schedule in terms of managing schooling kids from home and taking care of children from home, as well as taking care of your patients and your responsibilities. So sort of creating a household or a family schedule is also one positive way to help limit some anxiety and improve performance during this time. So of course, what's important to me right now, my family, immediate family and relatives, keeping my family safe, my relatives safe, that is of utmost importance to me. Also helping my fellow colleagues. As a physician and a surgeon, we've trained our whole life to help patients. It's really ingrained in our DNA. And so it's very important to me, particularly as I see how hard my colleagues are working, the huge need in both New York and this area of New Jersey. Helping my fellow colleagues is of utmost importance. It's also important to provide calm and peaceful hope and sort of disseminate that to everyone around you, and to try to maintain and provide information about health and wellness so that we can really take care of ourselves during this time to help take care of others. So there are a few takeaways from COVID-19 that I'd like others to know. Really the importance of social distancing and staying at home. I know we've heard this so much, but unfortunately it's not still consistently being done. No matter where you are in the country, this disease will affect you. It's very important to stay at home and certainly to social distance at least 6 feet apart. If you do have to go out to the grocery stores, for example, the importance of hand washing. I've always been very diligent on hand washing, I think since the age of 3. We've documented in my childhood diaries, but it's very, very important to wash your hands, to not touch your face. And of course, as I mentioned before, the importance of boosting your immune system by exercise, healthy diet, wellness, boosting your levels of vitamin D, taking 10,000 units a day, for example, boosting your levels of zinc, and then really trying to stay mentally healthy. I think that's a big challenge now with being at home, not being able to do the activities you normally do. If you're able to get fresh air every day, even if it means just taking a walk around the block, Very, very important for your mental health. Sit outside, get some sunshine, and really try to use these tips that I mentioned to deal with anxiety and stress during this time. I think I've said this already, but these are definitely ways that healthcare providers can help manage anxiety during COVID-19. You know, mindfulness, focusing on one activity at a time, meditation, yoga, an application called Headspace, which is very helpful for the above. Really try to change your relationship with the media so you're only relying on 1 or 2 reliable sources 1 or 2 times a day, really addressing basic needs for health and wellness, and most importantly, staying connected to your colleagues, family, and other important people in your lives. So with that, I'd like to say thank you. I wish you all the best. Please do stay safe. And all of our providers on the front lines are really true heroes. Thank you.